Hi, my name is Catherine Chig. I'm the founder of Central American Medical Outreach. Our history is that I was in Peace Corps from 1979 to 1981. During that time, I saw tremendous need of equipment. My last month, just to get some statistic, I counted how many babies had died, 31 babies. It became so evident to me that the government was unable to respond to basic needs to save those babies' lives. When I came back home, I thought, what can one person do? And I did not return until 1989, when I found conditions worse. Santa Rosa is a community of about 46,000 and it lays in the mountains of the western part of Honduras. In this region, we have about a 50% underemployed or unemployment rate. As you walk around the city, you'll see a big cross-section of different people. It has people young, old, wealthy, and very poor. And you can see that cross-section every Sunday in the park or at the market. Happiness has nothing to do with financial wealth. It has to do with what's inside, and it has to do with knowing how to live well with little. This is what I see in the Honduras community. The sadness that strikes me is that when these people's lives are cut short because of not having the supplies and things that we actually throw away in the United States. And that's really sad to see a child without a mother because they died of something that was totally preventable or something totally treatable. And that's what CAMO is about, making sure that those kind of innocent, stupid deaths don't happen. Central American Medical Outreach was established in 1993. It has grown from a dream to an organization that serves 90,000 people per year with 16 different programs. This is a public health clinic where CAMO has 5 programs. Those programs are dental, mammography, x-ray, cervical cancer, and ultrasound. This center sees around 200 patients a day. It's one of the largest centers in Honduras. You'll be seeing many of those programs and their function. Right now we're in the ultrasound department. This was started about 5 years ago, and it was started because a good friend who was the director of this public center expressed to me that a lot of women were not being diagnosed with early pregnancy problems and therefore being mismanaged, or even the loss of the baby and the loss of the mother. So because of that, we put a first ultrasound machine in 2003, and from that time now we are doing about 100 ultrasounds a week. With this, we've saved a lot of moms, a lot of babies, but also more importantly, they're able to give good care, prenatal care. With the funds recuperated, each patient pays $5 for the ultrasound, and with that money recuperated, we were able this year to buy a new ultrasound machine, and that's the machine being used right now.
Well, he probably needs a little bit more cartilage in order to get
Plastic surgeons have been coming to Santa Rosa to help CAMO for 16 years. Primarily, they focus on children with birth defects.
2 more years.
As many as 6 surgeries are completed every day. Families from hundreds of miles away make the difficult journey to reach the clinics so that their children can have medical attention.
Where it diminishes is about it.
Yeah, right.
We need this length.
These doctors in some cases are training their Honduran colleagues to perform these highly specialized operations. We are very fortunate to have this level of volunteerism. This baby and thousands more will grow up without any trace of disfigurement they were born with. Eye Clinic is a wonderful area. We started that in 1993, and that was because the only eye surgeon for this 1 million population was working midnight shift. And when I asked him what was needed, he said, "Give me a microscope." And when I got the microscope, I was able to sign a contract with Ministry of Health saying, with the instruments and the eye microscope, could he please be the eye surgeon for this region?
So the wound looks tight, not leaking. Cataract surgery for folks in this level of vision is important because otherwise there's no one to care for them. They sit in the corner at home and sort of die on the vine as time goes by. If we can supply care, they can either become functional or at least self-sufficient enough to take care of themselves. So we hope we provide that in this case.
Gracias al de arriba y gracias a todos ustedes.
Oh, she said,
Thank you from above.
and thank you to all of us.
The mobile dental unit always goes to the small villages that have no dentist in it. We are able to set up 3 chairs and 3 units, and any given day we're able to see 100 children on those mobile units. We've been doing the dental program since 1993. It was our first program that we started, and every year it has gotten better. This is the warehouse that feeds the programs and also feeds the clinics and the public health clinics. It's a pretty big facility. These items come from all over the United States. Sometimes in medical companies, a tow motor will hit a stock of them, so that bottom box needs to be thrown out. We will go through that box, and anything that's damaged will be thrown away, but the things that are tightly sealed that have not been damaged in any way, we get those. Patients who have died with hospice many times have a lot of new supplies delivered, but it can't be taken back. Hospitals that are cleaning out their warehouse, clinics that are cleaning out their warehouse, all those kind of supplies come to us. This is a wheelchair area. We get many wheelchairs donated from individuals who no longer need their wheelchairs, and then also different organizations collaborate with us. We give away about 150 wheelchairs a year and have about 400 different wheelchair clients that come in for repairs of their wheelchairs. So we also do maintenance of their wheelchairs. In this area, we have a lot of equipment that's been donated by different institutions and hospitals. They're good ultrasound machines that you're seeing here, but we also maintain them and repair them, and we have a crew down here doing that right now. CAMO has expanded its service not only to meet that medical need, but also to meet the community need. The story's kind of interesting how CAMO became involved with the trade school. Again, that's about relationships. One of the elderly men of the largest banks here in Santa Rosa came to me and said, "Kath, can you please help me with the trade school? It is failing, it's been abandoned, there's really no good leadership in it. Can you help me do something?" So 4 years ago, we took this on, and at 0 production of students, and now they are graduating over 500 students, and it has expanded into different areas. The kitchen is a lot of fun. Not only are those women learning how to cook, but also now they're learning about food safety, so they can take it into the restaurants in the different areas so that when people do eat out, that they're not going to be getting sick. So that's one of our efforts in community health. One day about 10 years ago, I walked into the maternity ward, and a woman was going into cardiac arrest. When I walked in, I saw that nobody really knew what they were doing in basic CPR, so I intervened at that time. The woman did die, but it created such a desire in myself to make sure that this wouldn't happen again. We give a lot of classes on basic CPR, PALS, NOWS, and ACLS. This is fun to see because after every class, it never fails that a student comes back and says, "For the first time ever, I had a patient that arrested, but guess what? They didn't die." So it's a great joy to be able to put the right protocols and tools to the right hands to save a life. In 2002, I was asked for assistance for the daycare center. And when I walked into it, my heart broke. There was mildew and mold halfway up all the walls. There were no screens on the windows. The babies had flies on their face. So at that point, it became a very needed item to make sure that these children were in healthy environments. CAMO gives $8,000 a year to employ the teacher, to give a good diet, at least vitamins, and then on every Friday we make sure that all the children get a protein diet too. If you really want to make an impact on the world, it isn't about putting your name on a building. It's about really getting the money and the funds where it's needed. We can do so much more by working under the health system and the Ministry of Work by helping augment or supplement where they are falling short. Really what's important with if you're a humanitarian isn't your name on something, it's these guys. It's taking care of the babies, it's taking care of the moms, it's taking care of people and loving them no matter what, no matter where. CAMO's like an onion. As you peel back the layers, it gets richer and richer. If you want to know more about our programs, please visit our website at www.camo.org. Thank you.